So welcome to Baylor. I'm just going to discuss kind of the services that we provide in the health center itself, and then Lisa will discuss all the student health insurance information. We are basically a full primary care facility. We also have psychiatry, a physical therapist, and a fully stocked pharmacy that carries over-the-counter medications as well. We are located on the second floor of the Student Life Center. I'm not sure if you're familiar with it, but it's where the rock wall is and the gym. We are on the second floor of that building. Our hours during the school year are Monday through Friday, 8 to 5. And during the semesters, the fall and spring semester, we have a Saturday clinic from 9 to 1. We do not do that during the summertime. We have 7 primary care providers, 5 physicians, and 2 nurse practitioners. We have 1 psychiatrist, a psychiatric nurse practitioner, 1 physical therapist, and 10 nurses in our clinic. We can do pretty much everything your primary care physician's doctor's office at home can do. Welcome. Some of the services that we provide, we do urgent care sick visits. We do well women's exams, men's health exams. We deal with orthopedic injuries, lacerations, we suture. We have physical exams. We also do allergy shots, give immunizations. We have appointments for mental health visits as well. That is different from the counseling center. We can do a lot of anxiety and depression visits as well. And we also do travel visits if your student wants to go study abroad or go on a mission trip. We just check to make sure that they've had all their immunizations and all of that. If we have an emergent situation, we can take care of some emergencies. If it's beyond our scope, we will generally transport them to one of the local hospitals here in town. A new feature that we have that we just started last fall is our free 24/7 telehealth. It is available, like I said, 24/7, and it is absolutely free for students. There is a service key that you will have to enter when you set up your account. It will, and then you have to enter that same key as the promo code to take the charges off.
It's right here on the back.
So if you're feeling lousy in the middle of the night and you want to talk to a doctor, you can just log in and that can be taken care of. We also, through that service, offer nutrition, psychiatrist visits, and counseling as well. So all of that is totally free for the student. Let's see, we encourage you to please turn in your health forms and your immunization records. We upload that into your medical record. So if you're ever injured while you're here and you need a tetanus shot, we can go back and see when your last tetanus was. So that's very important for us to have that. We also have a health portal. It is on our website. It is available to make online appointments. You will get lab results sent back to the portal. You can communicate with your provider, like through secure messaging back and forth. You can look at the notes that are written when you come in for your visit. You can see all your lab work. And the most important is you can see all your immunizations. So if somebody needs it to go to nursing school or medical school, they can print it right from there. We do encourage you, if you're doing an online appointment, to book early. We fill up very, very quickly. Like I said, we only have 7 primary care providers, and there's, what, 20,000 people here on campus. The urgent care appointments that we have are considered kind of same-day appointments. But they are available at 2 p.m. the day before to schedule for the next day. And that opens up all throughout the evening. So if you wake up at 9 o'clock at night and you do not want to do telehealth, you can go into the health portal and schedule yourself an appointment for the next day. Other appointments that can be scheduled ahead of time are your allergy shots, immunizations, well woman exams, and physical exams. We do have some extended appointments available. Those are for visits that will take extra time. Things like abdominal pain, chest pain, if you need to have a toenail removed. So you want to make sure that you pick the correct appointment type that you need. One thing I want to let you know is we can do some point of care testing in our clinic, strep screens, mono, flu screens, COVID tests, basic tests that we can do in our clinic. Any other lab work will go to clinical pathology laboratories. So you might want to check with your insurance to make sure that they're in network with CPL labs. You will get a bill, CPL will actually bill your insurance, it will not come from us. Everything we do in our clinic, like the point of care testing and office visits, that will go through your insurance and be billed through Baylor. But outside labs will have to go through CPL. We also accept outside providers' lab orders. If your student is, say they're on Accutane and they need blood drawn, once a month, the physician can send in an order. We will draw the blood, send it to CPL. We will not get the results back. It'll go directly back to your doctor that ordered it. And one last thing I want to discuss is Hepa and Ferpa. Your student is considered an adult when they come to college. We do not have a blank consent form that they can sign that we can talk to you about every visit that they come to. That does not happen. What they need to do is, if you want to ask us any questions or find out about their visit, we have to have a written release from your student for every visit that we can discuss. We can make it general, like if they're coming in for diabetes or something, all the visits for that. But any other visit, we need to have a written release form. And I know it's difficult for some parents because they're like, I'm paying for my child's tuition, I should be have that available. But that is not the way it works here. Students, if you're using the online portal, you log in with your Bear ID and password. If you give that to your parents, they will have access to your medical records. So that is something that you want to think about.
Everything? I think so. Okay. So we will attempt to bill any insurance that you guys provide to us. We can provide you our group NPI or individual doctors' NPIs if you guys want to call and check and make sure we're in network. We won't know if you're in network with your specific plan, so we ask you to call your insurance just to verify. We are in network with most major plans, but some of the smaller, lesser known ones, we may not be. But we will attempt to bill any insurance, and what comes back not covered, we will place that amount on their student account, so they don't have to worry about coming in with any kind of means to pay the day that they're not feeling well. I know the pharmacy typically takes payment for prescriptions, but if you can't provide that day, they also have the ability to place that account or that amount on their student bill as well. We do, for those students that don't have any insurance or that have an insurance in a state not here that you can't use anywhere else, we do offer a plan through Academic Health Plan. It's a Blue Cross Blue Shield of Texas plan. It's widely taken and widely in network here and across other states too. So say if you're from California, you can find Blue Cross Blue Shield of Texas providers there when you're home on break or for the summer if you do sign up for this plan. It is a low $500 deductible. Office visits are billed at $35 copay, specialists are $45 copay. Any kind of hospital surgical procedures are covered at 80%. The monthly rate is about $280 a month. You can set up a payment plan through Academic Health Plan, or you could have it billed to your student account, and that amount would be billed one time in the fall, and then in one amount, and then one time again in the spring and summer. And I've got these information sheets if anybody wants to pick this up and look up some more information about it. We do have, for those that do not have any insurance and do not want to sign up for this or find any other insurance, we do have what's called a prompt pay discount. So if they can pay the same day, we can knock 40% off of their services that day, excluding vaccines. We don't have any markup in any of our vaccines, so we are not able to discount those. But we can take 40% off the labs that we are able to run. No, we won't be able to do that for anything that goes to CPL because that's not ours. But office visits, like that toenail removal, small procedures that we might do. But they do have to pay that same day before they leave. And it's a very quick, easy process. Anybody have any questions?
So if I was to schedule an appointment with counseling department, is there a limitation on visits or is that just dependent on my insurance?
They do not bill insurance from the counseling department. They're separate from us.
Okay.
As far as I know, the visits are unlimited, but that, you need to check that for sure with them.
Okay.
There's walk-in available. You can go in and they'll do like an initial assessment on you and then decide, either have community care or care within our counseling center. But they can answer your questions through the counseling center.
And can I set up an appointment before school starts or does it have to be when school is in session?
As long as you're registered, you can set up an appointment.
Also on this,
Yeah, I don't think you were here for this.
yeah, the telehealth, also, there's counseling available on this, there's no charge for this. This is done, via Zoom or Skype or however it is they do it, or over phone. So it's not our providers, but this is 24/7 and there's no charge for this too.
Right, I don't think they were here for that. This covers, it's 24/7, completely free. There's a coupon code and a service key you have to enter to take the charges off, but there's counseling available.
At the
That
bottom.
you have to call the number for the medical services, psychiatry, or nutrition. You can log into their website and do those right away. It's nice because you set up an account, you can pick your physician. We've had very good responses from students, especially in the middle of the night. They're waking up and they feel terrible. They log in, they get seen by a doctor, and you just need to remember what pharmacy you put in and make sure if it's in the middle of the night and you need the medicine, make sure you go to like a 24-hour pharmacy.
And then, oh, sorry.
No, go ahead.
How do the code, like, where do they get the code to put in?
It's actually right on there, and it's
Right on
actually
the
on our
bottom,
website.
at the bottom on the back.
Bottom on the
Is
back.
it AC something?
ALTBAYLU.
And if they go to the health center website, there is a tag right at the top, 24/7 care, click here, and it will go through detailed instructions on how you go and make those appointments and where you put the codes in and all of that.
I would advocate this over the urgent care on the other side of the highway. Because after 9 p.m. they charge emergency room rates. Just a heads up.
And it's very expensive.
Yes. I mean, go there if you have an emergency, certainly, but you might try this first. It might save you a visit and a bill. Sure, what you got?
So are like basic check notes, are they still billed interest, I'm guessing, or are they included in the free 20% pay?
If you come to our clinic for a physical exam, it is charged to your insurance.
I'm not sure they do.
I don't-
Exam.
Right, I don't think they do physicals because we need to listen to your heart, we need to listen to your lungs, and we may have to draw lab work and things like that. These are more for like kind of urgent care kind of things, colds, UTIs, things like
Your
that.
overnight,
Exactly.
weekend, Sunday afternoon.
And all of those are free though?
Correct,
Mhm.
correct.
Listen, how do you transfer a prescription here? Because if she, takes something every month, how do you transfer that here and then do we notify you when you request it? Because I know when we transfer it home, the pharmacy requests the transfer.
Correct. You
Okay.
can either stop by our pharmacy or their extension is 710-4991 and have them request it from your pharmacy. Or you can do it on your end and say you want it transferred to the Baylor University Health Center Pharmacy.
Okay.
Make sure you specify that or it could get sent to Baylor Scott and White. And we are not part of Baylor Scott and White.
What is it that they're like?
Baylor University Health Center Pharmacy, I think that's what the name is. Or Baylor University Pharmacy.
Just clarify Baylor University.
No,
Right, not
Baylor.
Not the hospital, Baylor Skyway.
And you can contact our pharmacy, it's like I said, 254-710-4991.
Can you say that one more time? I'm sorry.
254-710-4991.
Okay, perfect. Thank you.
So from what I'm hearing, you guys have like a physical pharmacy within the campus?
Yes, I'm sorry, you came in late. Let me tell you, we are a full-fledged doctor's office, like you would at your own home doctor's office. We are located in the Student Life Center. Are you familiar with that? Where the rock wall and the gym is?
I heard of it, but I'm not too sure
Okay,
where it
it's
is.
right across, actually almost right across the field from where we are now, and we are located on the second floor. We are open 8 to 5, Monday through Friday, and then during the school year, we are open on Saturdays 9 to 1. And those are mainly for sick visits, not physical exams. Those type of things we do during the week. You can schedule online. We have a portal that you use your Bear ID and password to log in. You can schedule appointments, you can schedule vaccines. If you need COVID testing, you can schedule that online as well.
Do you know where the portal is at? Like where I-
Yes, go to baylor.edu/health services. Any other questions? Yes, sir.
Can we just like, where's your clinic at again? South City, right?
It's in the McLean Student Life Center.
Okay.
If you go straight out this building, cross the field that's there, you'll see there's like a bear in the circle driveway. The building right behind it is the Student Life Center.
The big round one.
Right, where you go, like the gym is there, weight rooms, racquetball, basketball, all that, and the rock wall. If you just go in, go up the stairs, we are right at the top of the stairs.
All right.
If your student has any like chronic medical conditions and you want to transfer their care to our physician, you can set up an appointment either while they're here now or right after they come back to kind of get the continuity of care. If you want to send us records, you're welcome to do that. We do have some that, need a lot of care, and they come and see our providers. We get their medication lists up to date, and just so that we know who they are and they know where to go if they need help.
We do that on the phone as well, if we call, like,
To schedule an appointment,
no, just to let you know, like, their medical condition and or any of that
we
stuff.
prefer to have a visit. Just that way, when your student is there, they can see who the physician is, and we can get a lot more information than over the phone.
Okay.
And if you have records, you're certainly welcome to send them to health_services@baylor.edu. It's a secure email,
Okay.
and NYCHA gets those, and we can enter that into their record as well.
Can you repeat that email? I'm sorry.
health_services@baylor.edu.
Thank you.
It's where you'll also send your health forms.
And
If
if you
you
have
want to
any,
send them electronically.
if you have any questions, our main number is 254-710-1010. Well, welcome to Baylor.
Thanks.
I was saying real quick, it was health_services@Baylor.
Baylor.edu.
Can I ask you a specific question?
Absolutely.
Insurance